Have you ever found yourself staring in the mirror, fixated on a tiny flaw that no one else seems to notice? Maybe it's a small blemish on your skin, the shape of your nose, or the way your hair falls. For most of us, these are fleeting thoughts. But what if that thought became an obsession? What if it consumed your every waking moment, causing immense distress and making you feel like you had to hide from the world? This is the reality for people living with body dysmorphic disorder, or BDD. It's more than just being a little insecure about your looks. It's a serious mental health condition that can completely take over a person's life. Today, we're going to shine a light on BDD, understand what it is, how it affects people, and most importantly, how to find a path toward healing and self-acceptance. Because everyone deserves to feel at peace in their own skin. So, let's break down what body dysmorphic disorder actually is. Imagine your brain getting stuck on a loop, replaying a negative thought about your appearance over and over again. People with BDD experience an intense preoccupation with what they perceive as a defect in their appearance. Here's the crucial part. This flaw is often completely unnoticeable or appears very minor to others. But for the person with BDD, it feels enormous, grotesque, and defining. This isn't vanity. It's a genuine and distressing obsession that they can't simply switch off. These intrusive thoughts can focus on any part of the body. Common areas include the skin, like acne, scars, or wrinkles, the hair, worrying about thinning or excess body hair, or facial features, like the nose, eyes, or teeth. It can also be a more general concern about body shape, muscle size, or symmetry. The person with BDD truly believes there is something fundamentally wrong with how they look, and this belief causes them significant emotional pain, anxiety, and shame. This intense obsession with a perceived flaw drives a set of repetitive, compulsive behaviors. These aren't just habits. They are rituals performed in a desperate attempt to manage the overwhelming anxiety BDD causes. One of the most common behaviors is mirror checking. This isn't a quick glance to see if you have food in your teeth. This can be hours spent scrutinizing their reflection from every possible angle, under different lighting, trying to either confirm the flaw or find a way to see themselves without it. Paradoxically, this often makes the anxiety worse. On the flip side, some people with BDD avoid mirrors and all reflective surfaces entirely because the sight of their reflection is too distressing. Another common behavior is camouflaging. This can involve using heavy makeup to cover skin imperfections, wearing baggy clothes to hide body shape, or constantly styling hair to cover a perceived bald spot. The effort and time that go into these camouflaging techniques can be exhausting. The compulsive behaviors don't stop there. Many individuals with BDD engage in excessive grooming, like skin picking to try, and fix blemishes, which can unfortunately lead to actual scarring and skin damage, creating a vicious cycle. There's also reassurance seeking, where they might constantly ask friends or family, "Does my nose look big?" Or, "Can you see this scar?" Even if they get the reassurance they crave, the relief is only temporary, and the doubt quickly creeps back in. Comparing their appearance to others is another huge component. This can happen constantly, whether it's with people on the street, celebrities in magazines, or influencers on social media. This constant comparison almost always leaves them feeling inadequate and reinforces their negative self-perception. These behaviors aren't choices. They are compulsions driven by a powerful underlying anxiety, very similar to what's seen in obsessive-compulsive disorder, or OCD. In fact, BDD is classified as part of the obsessive-compulsive spectrum of disorders, highlighting the shared pattern of obsessions and compulsions. The impact of BDD on a person's daily life can be absolutely devastating. Think about how much mental energy is consumed by these obsessive thoughts and compulsive behaviors. It's like having a full-time job that you can never clock out from. This can make it incredibly difficult to concentrate at work or school, leading to poor performance or even dropping out. Relationships suffer too. The person with BDD might avoid social situations, parties, or even family gatherings because they feel too ashamed or anxious about their appearance. They might fear judgment, or believe that everyone is staring at their perceived flaw. This social withdrawal leads to profound loneliness and isolation, which only deepens the cycle of depression and anxiety. They may turn down promotions, avoid dating, or stop pursuing hobbies they once loved. In severe cases, some individuals become housebound, unable to leave the perceived safety of their home. The emotional toll is immense, with high rates of depression, anxiety disorders, and a tragically high risk of self-harm and suicidal thoughts. It's a condition that steals joy, connection, and opportunity from a person's life. It is absolutely crucial to understand that BDD is not a sign of weakness or vanity. It is a recognized mental health condition, and like any other health condition, it is treatable. The first and most important step is reaching out for help. If anything we've discussed today sounds familiar, whether for yourself or for someone you care about, please talk to a doctor or a general practitioner. They are the gateway to getting a proper diagnosis and being connected with the right support. A GP can listen to your concerns without judgment and can refer you to a mental health specialist, like a psychiatrist or psychologist, who has experience with BDD. Getting a formal diagnosis can be a huge relief in itself, finally having a name for what you're experiencing and knowing that you're not alone. The journey to recovery starts with that single act of courage: asking for help. It's the first step towards reclaiming your life from the grip of this disorder. Once a diagnosis is made, there are effective evidence-based treatments available. The most common and effective form of therapy for BDD is a specific type of cognitive behavioral therapy, or CBT. This therapy helps individuals identify the irrational, negative thought patterns they have about their appearance and teaches them how to challenge and reframe those thoughts. For example, a therapist might help a person question the evidence for their belief that their nose is deformed. Another key part of CBT for BDD is something called exposure and response prevention. This involves gradually facing the situations that trigger anxiety, like going out without makeup or reducing mirror checking time, without performing the usual compulsive behaviors. It sounds scary, but it's done in a controlled, supportive way, and it helps the brain learn that the feared outcome doesn't actually happen, reducing anxiety over time. In some cases, medication, specifically a type of antidepressant called an SSRI, may be prescribed alongside therapy. These can help reduce the obsessive thoughts and compulsive urges, making it easier to engage with and benefit from therapy. Treatment is a process. It takes time and effort, but recovery is absolutely possible. If you are struggling with thoughts of harming yourself, please know that your life is valuable and that help is available right now. Your feelings are valid, but they are not the full story. You can get through this. Please reach out to a crisis hotline or emergency service immediately. We will list resources in the description of this video. You don't have to go through this alone. There are people who want to listen and support you 24/7. Your safety is the most important thing. Talking to someone can make all the difference. Please, make that call. Living in a world so focused on appearance can be tough, but it's important to remember that your worth is not defined by what you see in the mirror. You are so much more than your physical appearance. You are your kindness, your creativity, your thoughts, your passions, and your strength. For anyone struggling with BDD, remember that what your brain is telling you is not the truth. There is a path to a future where you can look at your reflection and feel peace, not pain. The journey starts with compassion for yourself, and the courage to seek help. Thank you so much for watching, and for taking the time to understand this important topic. If this video was helpful, please give it a like, and consider subscribing for more content on mental health and well-being. Share it with someone who might need to hear this message. Take care of yourselves and each other.